Great. Good afternoon, and thank you all for joining us today on International Women's Day. My name is Shannon Razsadin, and I'm the President and Executive Director of the Military Family Advisory Network, MFAN for short. As an organization, we're really focused on understanding the lived experiences of military families in the areas of healthcare and general well-being. Today, I am so honored to be joined by remarkable leaders in military healthcare. These women have built careers at the intersection of two male-dominated industries, the military and healthcare. And in a few moments, they'll introduce themselves, share some of their stories, and then we'll take a few questions about their work and the impact that it's had and will have on our community. So let's start with introductions. Colonel Sheets, we'll start with you.
Thank you, Shannon. Good morning, and thank you all for joining. And my name is Christina Sheets. I am a colonel in the United States Air Force and a prosthodontist or dentist by trade. And a little bit about myself. I have always been surrounded by people in the healthcare professions. Many of my family members are nurses or other healthcare providers. So at a very early age, I was drawn to helping people and taking on challenges in that area. After I completed high school, went on to college, and really enjoyed there, once again, the challenge of science, and decided that my future path would be in dentistry. At the time, I never really gave it a lot of thought, that it was a predominantly male profession at that time. And when I started school, realized that very quickly. But I didn't let that deter me. I engaged and was excited to help people and the challenges that it posed, and was successful there, and decided my future path was not only to further my education in dentistry and become a specialist in prosthodontics, but to join the Air Force. And it was interesting at that time because the policy was you had to join the Air Force and do a tour before you could even apply to a residency training program. And I wanted to go directly into residency. And so I got an agreement that I could be accepted. And if I was accepted, I would then join the Air Force. And that is what happened. I was accepted to the prosthodontics residency training program at Wilford Hall, and later that day accepted into the Air Force. At that time, I was the third female who had ever challenged and graduated the program. And I graduated, luckily, first in my class, and went on to an overseas assignment to a leadership position immediately at a high ops tempo fighter wing. So it was a strange path that got me here. But the one thing I will say is, jumping in the professions or in the areas that have typically been male-dominated professions never deterred me. And I would say that, stepping up and taking your seat at the table and taking on the challenges that come and excelling and doing a good job at them has always given me a path forward to new opportunities. Back to you, Shannon.
I love it. Thank you so much. Lauren, would you mind introducing yourself and your role?
Absolutely. So hi again, or hi everyone, and thank you, Shannon, and really appreciate the opportunity to be here and speak with you all today. My name is Lauren Andry. I serve as our Chief Health Information Officer at Oracle Health for our defense and military health teams. So I have the honor of working with Colonel Sheets and Trisha on a regular basis as we work to transform healthcare across the MHS. Similar to Colonel Sheets, but different, I had an unconventional path to where I got today. For starters, I know we're here talking about healthcare technology, but my first bachelor's degree is actually in English literature. So not exactly the most common background in the education field to where I ended up today. But fresh out of college, I started working at a nonprofit organization, putting those writing skills to use in support of an organization that helped to fund our local hospitals and the families that were served there. And during my time working there, I just was very fortunate that they were beginning their journey as a hospital to transform from paper documentation to electronic health records. And so with that, they were looking for people that wanted to come and help to train the providers and the nurses on this new system, which now I know to be Cerner or part of Oracle Health. So I took a leap of faith and I decided to jump into something that I had never done before. As Colonel Sheets said, healthcare traditionally has been a male-dominated industry, but I was very fortunate, and I'd be remiss not to call out some of the female leaders, like my mom, who is a now retired but was a 40-year nurse, ED nurse and nursing director. So I joke that I got to spend my childhood taking naps on her office floor after school while she was finishing her shifts. And so I was always comfortable in the healthcare industry and in that field and in that space, long before I ever decided to come and work there. But with that opportunity to train, despite knowing very little at the time about healthcare or technology specifically, I was able to help get clinicians ready for the new system. And while I was teaching them the technology, they were really teaching me about healthcare. And during that process and seeing the people that I had known my whole life through my mom and her colleagues, I was able to start down a path myself to go down to nursing school and to explore the opportunities that presented there. And so I'm so thankful that I did, both in my education, getting my bachelor's and master's in nursing. I encountered so many strong female leaders that really showed me the way in terms of what is possible in this industry. They were, of course, in academia, but they were in research, they were in informatics, they were in healthcare administration. And so it exposed to me very early on in my career how many opportunities are available and things that we may not have even realized for ourselves at the time, what that industry and what those possibilities could lead to. So I would echo, as Colonel Sheets said, there are opportunities and take advantage of those. If it's of interest to you, take a chance. And once you get that chance, really make the most of it. And you never know where you could end up.
I love that. Thank you so much, Lauren. And Trisha, could you introduce yourself?
Yes, thanks, Shannon. Happy to be here today. My path that kind of led to my role in health IT was also different from many probably. I didn't start in healthcare, but have been personally impacted and seen friends and family impacted by the military health system. I spent many years in the IT space, which also happened accidentally. I was a human behavior or psychology major in college. But early in my career, I became involved in the federal contracting space, first in project management and then into program management, focused primarily in the federal IT space. So although I wasn't technical by trade, other than some required classes in College of Engineering, I learned I could pick up on the capabilities and concepts easily and became very interested in the IT that enabled the mission outcomes for our customers. So with Leidos, I spent time in defense and civil businesses primarily for a lot of my career, but I was especially excited a couple of years ago when I got the opportunity to move into the Leidos Health Group and get involved with our military and veterans health solutions. I combined my federal IT and software development program management experiences with my passion to be able to make a difference in transforming the healthcare of our service members and veterans and their families. I had experienced firsthand carrying around my medical records from the Air Force in a folder, hoping I would have what I needed to get the right care, and just thinking about the impact for those who serve and their families to have their medical records in a single system from the first day entering the military or even newborn starting in that system through their retirement and beyond was really a mission that I wanted to be involved in. So I would definitely encourage other women to explore the STEM fields, even if it wasn't your initial path like me. But as far as male-dominated field, I definitely have been outnumbered in almost all my roles, probably so far in my career. I remember one of my first management roles leading in a working group in my first week as the PM for a DoD communications network, supporting some key military aircraft. And I looked into the room, about 40 people, all men, and I felt like they were looking at me like, who is this and what is she doing here? But I continued on and over time built some great relationships there. It was one of my favorite jobs that I've had and was really able to get a lot done there. So I would, as far as advice for anyone I've mentored or talked about my career path, similar to what Colonel Sheets and Lauren have touched on, I always say, don't be afraid to step out of your comfort zone. Volunteer for those stretch assignments or even a lateral move or a special project that gives you a broader range of experience. Use your network and learn from them. I've done a lot of that, a lot of strong leaders that I've learned from over the years, and jump at opportunities for training or learning additional skills, both in leadership and technical aspects. So I found doing these things have really led to new opportunities and growth for me.
I love it. And I love how you talk about the transferable skills. I am another person who was a Spanish major, my master's in higher ed administration, and here we are. But that's something that the military community kind of sets you up for, and those frequent moves and, you know, the constant transitions that we go through puts you in, I think, a really awesome opportunity to flex and think outside the box, and you really never know where that might take you. So you three really are leading the way, you and your teams, in the modernization and transformation of what healthcare looks like for the military community. So we're going to get into some specific questions, and I'll start with you, Colonel Sheets. Can you talk to us a little bit about the deployment of the electronic health record and how it will impact military and veteran families?
Absolutely. And it's funny, as I listen to the other stories, I hear so many similar themes, right? And I spoke up front about how I pursued a career in dentistry and specialized. And after all the training that I spent doing that, eventually the Air Force sent me here to an assignment in health IT and informatics. And I was not a very tech-minded person. So it was probably the most, I would say, intimidating assignment of my life. I am the person who has to call IT to come back my printer. So I was questioning their good judgment, but they assured me they thought it was a good fit. And so when I did arrive here, I definitely had to do some training in informatics and also acquisition and IT. And, you know, I can say electronic health record gives us the ability to impact the military, their families, and all beneficiaries to a level that I never really appreciated until I was in this position. And as I came to the program, I was, you know, the dentist, and I rose to be a branch lead, and now when Mr. Slaughter retired, the PM of DHMSM, and leading the program, the deployment and the stabilization of the baseline. So I am really excited to do that. The healthcare record, I would say, the deployment, we are almost completely deployed stateside. We have 2 more implementation waves to go, one coming up here in the NCR very soon, and then another one in June. And other than Federal Healthcare Center level, we will be fully deployed CONUS. You know, and it's interesting because, you know, I talk as a military member, as a health professional, as IT, but I have another full-time job, and that's mom, right? So my husband is also an active duty colonel, and we have bounced around the world. About half of my time before here was spent at overseas assignments. And so I've been to Asia, to Europe, and brought my family, of course, with me. And I understand what it's like to have to register kids in school and have access to your health record, to receive care in the private sector, in other countries, even in other languages, and have to have your records translated and brought back. And how stressful that can be on the families to try to have a longitudinal record of the healthcare they received, the results, and things that people may want to access later. So I understand 100% from both sides of that, the experience, and I'm so excited that we are getting a tool out there, a health record that can not only document the healthcare, but use things like health information exchange, to bring in outside records and bring those community care documents into your health record, not just a copy or something somebody carried in and scanned. It's actual digital data. And the power of data is something we've never really had in our healthcare before. And I'm really excited about preventive health and health measures and all the things that we will be able to do that we have never done before. Patient portal access, being able to access all of our records and things through the portal, of course, is always important, in allowing our patients to really become the center of their healthcare. And this new model is really revolutionary for the DoD, in that before, you know, healthcare was episodic, and the record was based around recording from a medical legal documentation standpoint what happened. And we're really just changing that model, where the patient is the center. We want the patient engaged in their healthcare, access to their records, and to be a full participant in the care they and their family receive. So it's super exciting, and I'm so proud and humbled to be a part of this. And I think we're just really beginning to tap into the potential of what we'll be able to do with the data, the information, in the record. Back to you, Shannon. Thank you.
I love it. It's really going to empower people to be the owners, really, of their healthcare experience, which is so exciting. And I was one of those people, that had the big binder of all the medical records, when you're moving around and you really hope that someone's going to read everything, but having it all in one portal, I think is going to make such a difference on people's lives, especially as we look at exceptional family members and their experience with accessing healthcare as well. So Trisha, I'm going to go to you next. You all do a lot of work around the intersection of healthcare and overall well-being. Can you talk to us a little bit about that and the work that you're doing and how you're leveraging technology there?
Yeah, sure. Thanks. I'm excited to answer this question. Overall Leidos' mission is to make the world safer, healthier, and more efficient through technology, engineering, and science. And as a vice president in our health group, my current role is I get to look across all the health programs that we have and see all the exciting things we're doing as a lead healthcare provider of healthcare solutions for federal agencies across the healthcare ecosystem. We deliver secure, holistic health solutions to improve patient outcomes and system efficiencies. And we use our expertise in digital modernization, data analytics, which Colonel Sheets touched on, life sciences, as well as care enablement and human performance to address some of our customers' most important challenges. Our unique position as a technology company, along with the health and life sciences expertise, equips us to transform patient care in the military health system. So from IT and systems integration to those managed health services and clinical solutions and services, we have scientists, engineers, technologists, as well as behavioral health professionals providing solutions to the DoD. We deliver a broad range of customizable, scalable solutions. Obviously, the electronic healthcare implementation and optimization that Colonel Sheets and Lauren have touched on already. And the MHS Genesis system developed by the Leidos Partnership for Defense Health provides that single common record for medical and dental information, connecting healthcare teams across the DoD, Department of Veterans Affairs, as well as DHA and private sector providers. So as I mentioned, it's really exciting to be a part of that mission to implement that single common federal electronic health record to enhance patient care and provider effectiveness. Another area I wanted to highlight is in our non-medical counseling. So Leidos partners with the DoD on the military and family life counseling as well. So our MFLEX are credentialed and licensed behavioral health counselors who offer confidential non-medical counseling, consultation, as well as outreach services tailored to benefit military service members across all branches of the armed forces, as well as their spouses and their children. So the MFLEX are armed with capabilities of fully digital reporting, to touch on the technology piece there as well, reporting on trends and not individuals there. So these services across the MFLEX program are built on the systems, agencies, and military community resources that are already in place to ensure a complete and holistic care and support for our service members, spouses, and their families. So whether it's safeguarding health and wellness of the service members, veterans, and their families, supporting warfighters to perform at their peak, or developing the high impact systems like the EHR that deliver state-of-the-art function and efficiency to healthcare operations, the Leidos Health team is standing by to deliver.
That's amazing. And we regularly refer people to MFLEX. It's such an incredible resource that people have, and they're everywhere, right? And so really grateful for the work that you do and the training that you do for them, because they often are that first line of defense and support for military families, and something that they can count on regardless of where they're stationed. And so it is such a critical and important program. Lauren, of course, yeah. Lauren, on to you. Last year, I think I spoke at an Oracle event about my son had a traumatic brain injury a couple of years ago. And I remember when I was in the emergency room, in the trauma room with him, they were asking me when his last tetanus shot was. And I was in crisis mode and had no idea when his last tetanus shot was. And it was just one of those things I'm focusing on. Is my son going to be okay? and then trying to rack my brain on when his tetanus shot was and flu shot, all these other things. And that really, as we've worked with you, it's made this really meaningful to know that the electronic health record, it does so many things, but it also really helps people in those crisis moments be able to focus on the issue at hand. So can you talk a little bit about kind of what excites you about this and kind of what drives you? You have an incredible background as a nurse as well. And so I'm sure that there are some personal things that you've seen that really inspire the work that you do. Oh, I think you're on mute, Lauren.
It had to happen once.
Always was.
So yeah, thank you, Shannon. And I can't thank you enough for sharing your story with all of us at Oracle Health. And you're exactly right. As an ER nurse, I've been with a lot of families in that exact moment of crises. And the last thing that you're thinking about is the data. You're thinking about your loved one, you're thinking about your family member in that situation. And so I think as Colonel Sheets really teed up, what gets me the most excited about what we're doing here is the power of data and a single modern federal EHR and what that can mean for our service members, for their family members, for our veterans, and really all the beneficiaries that receive care within these facilities. Simply put, and we all say this, Colonel Sheets, you've heard her say it, Colonel Catalina and others in our meetings. Simply put, to me, it's about getting the right information to the right people at the right time to make those informed care decisions to help us achieve the best outcomes for our patients and the people that we're serving. And so I think we see that in a number of ways. And I think clearly Colonel Sheets and I and Trisha, we've all been working together long enough that we're really aligned on the opportunities that we see within this. And so I'd tee it up by talking about the perspective of the patient. And I think Colonel Sheets summarized that perfectly. We want to keep them at the center of care, and where historically patients were the recipient of care happening to them. Now, through tools that are enabled with our technologies, we're seeing patients really transform into an active and engaged participant and member of their health team. So through tools like our patient portal, whether that's sending direct communication directly to their care team members or using self-assessment tools, we're trying to enable proactive addressment of issues as they occur, as opposed to waiting for those emergencies to happen and then trying to reconcile and understand the full picture of the patient. And so by providing them with that patient portal and the tools at their hands, we're able to allow them to update information on their own and provide that back to the care team, as opposed to waiting for those clinic appointments or those emergencies to happen to get that most up-to-date information. And then as a clinician myself, I think when we look about the perspective of the care team in this, and how we need that information to make those critical decisions at times in those emergencies or even in our standard care. I think that's where interoperability and the health record interoperability and exchange is really where we're seeing a lot of power come. And I read the MFAN, recent survey, and from the respondents there, military families have told us that over 49% of the care they're receiving is happening outside of the MTF. And there's consistent numbers out there in the industry about service members, military families, and our veterans. And so while we want to ensure that when you're in the MTF, your care team has that information, we also recognize that you're going to need to seek care potentially in the civilian world and in the community. And so the health information exchange, as Colonel Sheets alluded to, it enables the clinicians on both sides of care to have access to that more holistic picture of who the patient is, so that we're not putting the onus on the individual to carry that paper record to and from. Instead, we're putting that in the hands of the clinicians when you arrive back at your primary care to continue your care treatment when you're going to those connected civilian partners. A couple of things too, I just can't leave without highlighting, I think is gaps in care is such a critical concern in healthcare. And particularly in a transient patient population like we see with service members and their families as they PCS and transition care teams. And so automated recommendations and reminders for clinicians within the EHR ensure that those gaps in care can be addressed at every visit or every interaction. So it helps us to be more proactive in how we're ensuring you stay up to date in addressing all of those care needs. And then lastly, we can talk about the clinical and the traditional medical or dental data that we're pulling in and those components of the health record. But, as your research has certainly highlighted, and as we know in the industry, financial and food insecurity, social determinants of health. There are so many contributing factors to the overall health and wellness of the patient. And I think the tools within the EHR that enable us to pull some of that detail forward and put it in the context of their medical record, ensure that those things aren't being treated or managed in silos, but they're truly part of the holistic care management for the patient. And so I think those tools, help to ensure we're getting the right information to our clinicians, empowering our patients, and ensuring that we're using technology really to support the best care decisions, which ultimately will lead to the best patient outcomes. And so I'm beyond excited about where we are and where we continue to go.
It's really incredible when you think about, to your point, Lauren, the transience of military life. We've heard so many times of people missing these critical screenings or appointments that they just haven't been able to get, or they've forgotten that they're due for because they move so often. And so having this all co-located, having those push notifications, like you mentioned, for providers, that's going to be really helpful as we also look at for the preventative care. That I've talked to a lot of military spouses who have, had lapses in mammograms, and those are the types of things that are really important as we think about the big picture in health. And again, getting to the preventative piece. And I love that you talk about the social determinants of health, because it's all part of what the well-being of military and veteran families look like. And so there are such incredible opportunities there, I think, to really get at those areas as well. I'm going to go to a question next from MOA, so the Military Officers Association of America. MHS Genesis deployment and healthcare workforce shortages can create access challenges. As you seek to modernize the system, will you consider a digital solution allowing patients to report access to care issues? And Colonel Sheets, we'll start with you on that one.
Yes, ma'am. And Shannon, that's a great question. And as we are strained in the healthcare profession as a whole, also in the DoD, to have enough healthcare professionals to see not only our active duty population, but all of our other beneficiaries, access to care is always a topic. And it can be the number of professionals, it can be the ops tempo at a particular location. And as those medical people get surged to cover down on other missions, that sometimes leaves a shortfall within the clinic, or it can just be the location of your assignment. Remote places and things may not have the hospital staffing and other types of access that people would desire. I would always remind people that every MTF does have a patient advocate. And if you feel like you don't have the appropriate access to care, or you're not being referred to care appropriately, I always encourage people to contact the advocate. It's listed in every MTF when you walk in the door, or if you call and ask for that person, they will provide you contact information to make sure you are seen and given care. Barring that, there are other avenues to care. With the patient portal, you now have access to your healthcare provider and team. And so you can always access there. I know it's frustrating myself. I have called the appointment line and trying to schedule a certain kind of appointment, and they don't understand necessarily sometimes the criticality. So sometimes, going directly to the professional that knows you best and explaining what you need or something they're already familiar with without having to go through the whole encounter again is often helpful. So I encourage people to interact with their healthcare team through the portal. Also, some visits now with MHS Video Connect, we have virtual visit options. And so some visits, you may need to have a quick conversation with your provider, and then you can maybe put in a prescription or do some action that is really time saving for both you and the provider, and really is a great service and quality of care that can also reduce the burden overall on the healthcare system. So encourage people. We're continually improving that and making access easier from all kinds of avenues. So if you haven't utilized that service, I encourage everyone because that does help the access as well. But ultimately, I think every provider wants their patients to be seen. So I encourage people, despite healthcare shortages, despite access to care, do the prevention. Most crises and disease are much more difficult to treat and require more of your time as well as the healthcare providers. That active preventive maintenance is always the key. So encouraging people to not neglect that, get those screenings, get those routine things done. That is helpful as well. So thank you, and back to you, Shannon.
Great, thank you. And I really appreciate the lived experience that you have, Colonel Sheets, and the authenticity that you're going through this too. And I think it's really heartening for all of us to know that the person who's in this role gets it. And so that really makes a big difference. And thank you for sharing that. The last question that I want to ask is really for the group, and it's about the potential. So where do you all see the potential related to the healthcare transformation, and what excites you most about that? And Colonel Sheets, will start with you, and then we'll go to Trisha, and then close out with Lauren.
Yeah, I would say to me, the potential is just, we are just at the beginning, and that I am so excited about data and data analytics and predictive measures that we can improve the delivery of healthcare, recommendations to providers to screen or do certain types of activities on patients that will catch things early and improve their quality of care. Also for patients to be engaged and full participants in their healthcare in ways that we really never have been before. So that excites me. Also just the access to record. We talk a lot about the portability of your record from service onto retirement, and as veterans receive care, having that longitudinal record. But, you know, I will say, as being a patient, as being a parent, an active duty member, I too have experienced all those things that you're talking about. And I will share that, you know, I realized it personally when I was stationed in Germany and I was pregnant with my first son. And all of my care was delivered out in a German hospital. And I had to fly back 6 weeks of my due date to the United States for my next assignment. And like many military families, my husband had to finish his assignment. And I was back stateside by myself, 6 weeks of my due date. And I arrived to Fort Carson, and I have no medical record. I have no treatment care documented because it was all in German and had to go through transcription and be scanned and uploaded to the system. So I was a high-risk pregnancy because of my age. And so the whole team was scrambling. And I felt lucky that I was a healthcare professional and could give them information about my glucose tests were normal and all the things that I know. But no healthcare professional wants to rely on the patient's recollection of their test results. And so I think about the cost of all the extra tests they had to put me through again, the time, the stress, right? It's stressful going through that. You're moving, you're PCSing, everyone knows what that feels like. And now you're having to go through all these tests within 6 weeks of your due date. And I think, what if I was a young enlisted person, right? What if I wasn't a healthcare professional? What would that feel like to me? Would I know? What if I was a high-risk pregnancy with a problem and I didn't know how to communicate that to my team? Would they catch it? And by the time my records showed up, my son was at his 8-week well baby check. And that's when my records arrived. Luckily for me, everything was fine. The team was great. But I wonder about all the times that that's not the case. And the power of this is really just to take care of our families, to take care of our active duty members, to have a complete record for our providers, to give the best care they can give, to have the analytics, and to really serve the people who serve our country. You know, these families sacrifice so many things, and I feel like it's our mission to take care of them. So that's been the best part of this experience, being able to affect so many families and do those things that I know they need. Back to you, Shannon.
I love it. Thank you so much for sharing that. Trisha.
Yeah, very similar to some of Colonel Sheets' comments there as far as the capabilities, you know, the more innovative capability, you know, we talked about video connect or virtual care from anywhere, where I think that more capabilities are becoming available to the community to be able to get the care that they need, regardless of where they're located, as well as the data, right? Using the data analytics that will be available as Just Genesis is rolled out across the DoD to really, you know, use that transformation to help understand, predict and improve patient outcomes, and optimize the care for the providers. I think it's a really exciting opportunity, and I look forward to see where it goes.
Awesome, thank you. And Lauren.
Yeah, tough to follow those two, and I agree with everything that's been said. I think what's really exciting and important to remember that the size and the scale of which we're doing this with the DoD and with the VA is something that's never been done before. And so with that, I think there's limitless possibilities and opportunities to really transform how we deliver healthcare, both within the military health system, but even beyond. And I think we're seeing that others recognize that. Certainly in our DHMSM program, we're seeing that with other agencies and the interest they have in the work that we're doing and wanting to join into this federal EHR. And so with U.S. Coast Guard, with MEPCOM, with NOAA, I think people are recognizing what it means and what the power is of the health transformation and the electronic records and what they can bring to the organization and the patients that they're serving. So it's always exciting to be part of the first of anything. And I think we're really doing something here that is the first of its kind and is something that we're going to look back on and be incredibly proud of with the impacts that we're able to make. So I think a couple of things about this that particularly excite me with the data and with having all of this in one key place. I think about research and the impacts there and how we're able to not only perform research at these grand scales with the amount of data that we're going to have at our fingertips, but also with tools like Colonel Sheets mentioned, the recommendations and the reminders that we've talked about, how we can bring research to life more quickly for our clinicians and for the patients. So I think the typical life cycle of turning research into action is like 16 years or 17 years. When we have the data and we have the technology available to turn that on more quickly for our end users and for the clinicians so that they have the latest and greatest capabilities and knowledge available to them to treat their patients, I think that's going to be incredibly powerful and something that we can focus on as we move to the future. And then certainly with the health information exchange, interoperability is so critical. And I think we're doing a lot of incredible work now within this program, and we're only going to be able to continue to grow that network of connected facilities. And I think having all of that information and access available to any care member, it really does holistically put the patient at the center, regardless of where they are. People are going to have the information that they need to most effectively treat them. And I think that that's going to really change how we think of the direct care that we receive within the MHS, but also how we can look at the care provided out in the community. How can we make that the most efficient, most cost-effective, and most timely for our patients so that we can break down some of the barriers like access to care, like gaps in care, by enabling this broader network of resources for us. So I think there's a lot to be excited about, and I'm very proud to get to work with these women leaders and female leaders in this industry to help go accomplish some of these goals.
Well, I certainly feel better knowing that you three are in these roles, and I'm really honored that you joined us here today to share about your experiences and the work that we all have to look forward to, right? I think that knowing what's to come and what's already been done is really exciting for all of us. And so I know that for each of you, this is more than a job. This is more of a vocation. And so thank you for the time, the energy, the passion that you bring to this, because it really is making a difference and it's going to continue to do so. So with that, we're going to close out. To everyone who's joined us today, thank you so much for being here. We hope that you learned something, and we should do this again. I think that people would really enjoy continuing to hear about these updates and the work that you three are doing. So thank you for your time and have a great rest of your day, everybody.